Welcome to the Regenerative Medicine Clinic at University Pain Consultants. I'm Dr. Rainier Guiang, Director of Regenerative Medicine. Today we're talking about low-dose naltrexone and how it may help with chronic pain. If you've been living with chronic pain and feel like you've tried everything, medications, physical therapy, injections, there's one treatment that often gets overlooked. It's called low-dose naltrexone, or LDN. It's not a new painkiller. It doesn't work the way most pain medications do. Instead, it works with your body's own chemistry, and the way it does that is something I find genuinely fascinating. Most people associate naltrexone with addiction treatment, and at a high dose, 50 milligrams, that's exactly what it's used for. It blocks the receptors in your brain that opioids attach to, which is why it works for addiction. But low-dose naltrexone is a completely different animal. We're talking about doses of just 1.5 to 4.5 milligrams, roughly 1/10 of the standard dose. At that level, it doesn't function as a blocker. It functions as a messenger, and the message it sends your body is a powerful one. Here's where it gets interesting. LDN is typically prescribed as a small capsule taken at bedtime. When you take it at night, it temporarily occupies the opioid receptors in your brain for about 4 to 6 hours. During that window, your brain notices that its natural painkillers, your endorphins and enkephalins, seem to have vanished. It's like turning off the water supply for a few hours. Your brain interprets this as a deficiency, and like any good biological system, it responds by ramping up production. It essentially sends an emergency signal: we're running low. Make more. By morning, when the LDN has fully cleared from your system, those receptors open back up. But now your body has flooded itself with a fresh surge of naturally produced endorphins, far more than it would have made on its own. This rebound effect means more of your body's own pain-relieving chemicals are available, and more receptors are open to receive them. With regular nightly use, research suggests this cycle can gradually reset your body's endorphin production to a higher baseline. Patients often describe it not as being numb to pain, but as simply feeling more like themselves again. Chronic pain is rarely just about the original injury. Over time, the nervous system itself becomes hypersensitive, stuck in a loop where it keeps amplifying pain signals long after the initial cause has resolved. LDN appears to address this at a biological level. Beyond the endorphin rebound, research suggests LDN also has anti-inflammatory effects on glial cells, the support cells in your nervous system that, when overactivated, contribute to that persistent pain cycle. So LDN works on two fronts: helping your body produce more of its own natural pain relief and dialing down the inflammatory process in the nervous system that keeps pain going. It's not a cure, and results vary between patients. But for many of our patients with fibromyalgia, central sensitization, and other complex chronic pain conditions, LDN has become a meaningful part of their care, and typically with very few side effects. If you're wondering whether low-dose naltrexone might be right for you, the best next step is a consultation. Our team at University Pain Consultants will review your history, your current medications, and walk you through all of your options. Visit our website or call us to schedule. The link is in the description below. The information in this video is for educational purposes only and does not constitute medical advice, diagnosis, or treatment. Regenerative medicine therapies, including platelet-rich plasma and cellular treatments, are not FDA approved for every condition discussed. Results vary between individuals and cannot be guaranteed. Always consult a qualified, licensed healthcare provider to determine whether any treatment is appropriate for your specific situation. University Pain Consultants is located in California and treats patients in accordance with all applicable state and federal regulations. Thank you for watching. If this was helpful, subscribe for more educational videos on regenerative medicine from our team at University Pain Consultants. I'm Dr. Guiang, and we'll see you next time.